So this is a soft tissue release technique for the lumbar erectors. This is a really good technique, and I use this with most of my patients on some level who've got lower back pain. So what we're trying to do here is we're trying to get into this big bulk of tissue here and just loosen it off. And then if we can, although this is indirect, you've got the QL underneath here as well, which you can influence as well. Now on some people you have to watch this area here, because soft tissue release techniques can be tender at the best of times, but this area here of flesh can be just quite fleshy sore. So you have to make sure that you've sunk correctly through that tissue before you start pulling it around. Now, really important to get your posture right. So you can either go 1 foot forward and back, keep your back flat, or you can do what I'm going to do, which is this sort of saddle position, as if I'm sitting on a horse. So one hand comes round and grabs the ASIS on the front of the hip. This hand is going to put palmar contact and work through the tissue that way. So it's a pulling and a pushing, moving that tissue away from the spine, like so. Now, that's normally how I start. To advance that, I'm going to cup and pull, sink through this gentle soft tissue here to get into here, and then the patient is going to pull this hip back down to the table. So relax, so sink in and pull, and relax, and relax, and pull, relax. Now you can then, and I do this quite a lot, especially on bigger people, I can do the same thing with my forearm.